Hi, everyone. My name is Kaylee, and I'm here with my partner, Val. And today we'll be talking a little bit about speech and language impairments. Val and I are both new students at Illinois State in the Communication Sciences and Disorders department, and we'll be working to earn our master's in speech pathology. So, this is a topic we're both super passionate about and excited to teach you about. First, I want to start with the disability definition. So, speech and language impairments can be defined as a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. This definition is from the Individuals with Disabilities Education Act website, but the same definition can also be found on the Illinois State Board of Education website. There's also a clear distinction between speech and language. They're not the same thing, so sometimes it's easier to talk about them as two distinct categories. Speech is how we say words and sounds. So this includes things such as our voice, articulation, and fluency. Voice is how we make sounds using our vocal cords and breath. Our vocal cords are in our larynx, which is if you touch the front of your throat, you could feel your vocal folds vibrate. Articulation is using our articulators to make sounds. Our articulators are things that can be seen in our mouth, such as our lips and our tongue, in the top or roof of our mouth, including our soft and our hard palate. And finally, fluency is the rhythm of our speech. So right now, I'm trying not to talk too fast or talk too slow, but talk at a pace where you guys could easily understand me. Moving on to language, language is how we use our words to share ideas, needs, and meanings. Expressive language is sharing our thoughts, ideas, and feelings, but receptive language is understanding what others are saying. So if someone has an expressive language disorder, they have trouble expressing themselves. Whereas if someone has a receptive language disorder, they have trouble understanding what others are saying. Now we'll move on to the prevalence of speech and language impairments. 5 to 10% of Americans have communication disorders, and almost 1 in 12 US children ages 3 to 17 have had a disorder related to voice, speech, language, or swallowing. The prevalence of speech and language disorders is highest among children ages 3 to 6 compared to children ages 7 to 10 and children 11 to 17. So younger children are more likely to have speech and language disorders. In addition, boys are more likely than girls, specifically boys ages 3 to 17, to have a speech or language disorder, which is super interesting. Again, these prevalence statistics can be further divided into two categories, speech and language. The prevalence of speech disorders in young children is 8 to 9%, and by first grade, roughly 5% of children have noticeable speech disorders. In addition, 3+ million Americans stutter. This statistic isn't necessarily about children themselves, but stuttering is a speech disorder. Moving on to language, almost 7% of Americans have a language impairment, with 3.3% of children experiencing language disorder in the past 12 months. So when looking just at children, children are more likely to have a speech disorder than a language disorder, but language disorders still occur in children. The first 6 months of life are crucial to a child's language development because they really need language input. That's why it's so important that parents are talking to, reading to, and singing to their babies as soon as they're born, because there is a critical period for language, and it's important that they get input as early as possible. Now we'll move on to the etiology or causes of speech and language disorders or impairments. The first is hearing loss. So I included a picture of two kids with cochlear implants. Cochlear implants are a device that are used for children who have or adults that have profound hearing loss. And so if someone has hearing loss, they may not be hearing the speech sounds of people around them, or they may have difficulty hearing their own voice. So if they can't hear their own voice, they may not be producing speech sounds correctly. Neurological disorders are another cause of speech and language impairments. This can include underlying conditions like Parkinson's disorder, multiple sclerosis, or ALS. So, for example, if someone has Parkinson's, that is a motor disorder. They have trouble with motor movements, and speaking is a motor movement. You're moving your mouth so much, even though you don't necessarily notice, so they could have trouble with speaking. The third cause could be brain injury. And brain injury is especially is especially prevalent if it affects the left temporal lobe, because this is where Wernicke's area is, and this area is necessary for language comprehension and language understanding. Another area that could really affect speech is the Broca's area, because this area is important for speech production. Intellectual disabilities are also associated with speech and language disorders, as well as drug abuse. Physical impairments are another cause. In the top right of the picture of this slide, you could see a picture of a baby who has a cleft lip. So a cleft lip is tissue that makes up the lip does not necessarily join before birth. And it's very similar for a cleft palate. So a cleft palate is when the tissue that makes up the roof of the mouth does not completely join together before pregnancy or before birth. So if these structures aren't fully formed, they again might not have the articulators necessary to form complete speech sounds, and they might sound muffled. Finally, vocal abuse or misuse can result in speech and language impairments. When I'm referring to vocal abuse or misuse, I'm talking about things like excessive talking, throat clearing, coughing, inhaling irritants, smoking, yelling, and screaming. So these are all things that are tough on the vocal folds that can change the voice quality. However, as you can see highlighted here, the majority of speech and language disorders have no known cause. Now I'll move on to assessment practices. First, talking about the purpose of assessments. So why do we do assessments in the first place? If a speech or language disorder is suspected, an in-depth assessment can be used to establish a specific diagnosis and assess the severity of the speech or language disorder. It could also help determine intervention and treatment strategies and establish a baseline for measuring progress and evaluating treatment strategies. So the whole purpose of doing these assessments is to help understand the child's diagnosis better so that we can help the child through intervention and treatment. Now, what is assessed during a speech evaluation? So an SLP will do all of these things. It's a very comprehensive evaluation. First, they'll assess their hearing ability and hearing history, because like I said, one cause could be hearing loss. Then they'll look at the history of speech language development and their general case history. So do they have another neurological condition or something else, such as an intellectual disability going on that could coexist with their speech or language impairment? They'll also look at oral motor functioning and feeding history. Swallowing difficulties or swallowing is a huge aspect of what a SLP also does. They'll look at expressive and receptive language performance, social development, the quality and resonance of their voice, and finally, the fluency or the rate and flow of their speech. Finally, we'll talk about the specific assessments that are used in an assessment. First, they'll use standardized tests of speech and language. So there are hundreds and hundreds of standardized tests that SLPs could use, and they're chosen just based on maybe what the SLP's favorite assessment is or what they think, what they're looking for specifically in the child. So I just included a few examples here. The first is the CELF. This stands for the Clinical Evaluation of Language Fundamentals. This assesses communication and language skills. The second is the GFTA, or the Goldman-Fristow Test of Articulation. This looks at the articulation of consonant sounds. And finally is the DAS, or the Differential Ability Scales Assessment. So this looks at cognitive abilities important for learning. So each one of these does something different. The first looks at language, the second looks at speech, and the third looks at cognition. But there are tons of other tests that could fall into these categories. Second, during an assessment, they may look at samples of spontaneous speech collected in natural environments. So this allows the SLP to gather data on language form, content, and use. And they might also look at observations of communicative interactions. So they might want to look at the child communicating with their mom or their dad, maybe with a sibling or with their best friend, to see also how effective the child is at communicating, specifically their wants and their needs. Finally, they might do a dynamic assessment, which may involve a brief trial of speech language therapy to see whether or not the intervention method they're planning on using is going to be effective for the child. So here I'm going to show you guys a really short clip of one of those standardized assessments that I talked about. This one is the GFTA, or the Goldman-Bristow Test of Articulation. So I'll play this for you guys, then we'll talk about it a little bit after. Here, a child isn't in this video, but instead a student clinician is filling in just to kind of model what the GFTA looks like.
Yes. Okay. So what is this? A house. And what do you call this? A door. Good. What is this? Pig. Good. What is this? Cup. Good. She is a girl, and he is a boy. Good. What is this? Yes. So red means stop, and green means go. Good. What is this? Duck. Good. What sound does a duck make?
Okay, great. So there you could see that the SLP is using pictures to ask questions. So that's really good for young children because it'll keep them more engaged and help seeing a visual will probably help them with those word finding skills. So the GFTA uses specific target words so that the SLP gets an idea of how the child produces all the speech sounds necessary in the English language. So that's why she's trying to get them to produce very specific words. And this whole time, the SLP is going to take notes on the child's pronunciation of all those words that she is eliciting. Then finally, today I'm going to talk about the DSM-5 diagnosis criteria, because this could also help SLPs determine if someone has a language disorder or a speech disorder. Again, these are categorized into two categories. So first, let's talk about language disorders. There's 4 different criteria, with the first being that the individual has a consistently hard time using language in different manners due to deficits in understanding or production. That include either reduced vocabulary, limited sentence structure, or limited ability to put words together to form basic grammatically correct sentences, or impairments in discourse for limited ability to use vocab and connect sentences or to keep up good conversation. The second piece of criteria is that the individual's language capacity is significantly below what is expected at his or her age, which may result in hindered communication, social participation, and academic achievement. Third, the symptoms set in during the individual's early developmental period. And finally, these given difficulties are not a result of a sensory impairment, motor dysfunction, or another medical condition. The criteria is very similar for speech sound disorders. So first, there's persistent unintelligible speech consisting of phoneme addition, omission, distortion, or substitution, which interferes with verbal communication. So here, when they talk about a phoneme, they're just talking about a speech sound that they're either leaving off of their words or adding to their words. Second, there's interference with either social participation, academic performance, or occupational performance. Third, the onset of symptoms is during childhood, and the symptoms cannot be accounted for by another medical or neurological condition. So these second, third, and fourth criteria are similar between speech and language disorders, but what makes them different is the classification of speech versus language.
So here we're going to move on to the characteristics of students with speech impairments. It does vary on the type of impairment. So there's both speech and language. So we're going to start with speech. And with speech, there is articulation, fluency, and voice. So articulation relates to the sounds. So this is going to be difficulty making certain sounds. They could be left off, added, changed, or even distorted. Leaving out or changing certain sounds, for example, saying wabbit instead of rabbit. And these types of disorders aren't usually a cause for concern until it continues past an age where children are expected to produce sounds correctly. So a child saying wabbit with a W at a year old is very different from a student at 7 years old already in school, substituting the W for the R in rabbit. Here is fluency, which is the flow of speech. And so this would be disruption to the rhythmic and forward flow of speech. For example, a stutter. And speech contains an abnormal number of repetitions, hesitations, prolongations, or disturbances. And you could visibly see tension in the face, neck, shoulders, and fists. For voice, there could be issues with pitch, loudness, resonance, or even the quality of voice. So the voice can sound hoarse, raspy, even harsh, and in some cases, nasally. People notice changes in their pitch, loss of voice, loss of endurance, and sometimes a sharp or dull pain with voice use. In this next video, we're going to see a little girl exhibit an articulation disorder.
Hi, my name is Grace, and my favorite movie is SpongeBob SquarePants, and I like my dog. I have lots of friends, and one of my best friends are Courtney, and I really want to be a vet when I grow up, and I like the color pink, and I like a lot of stuff because except for some animals, but I guess everything's good.
So here we see Grace, and she has a lot of trouble pronouncing her R's. So that's the main thing that we notice here. So it could be rhoticism, which is under articulation disorder, where a child cannot roll their R's or pronounce them. But this is what she is exhibiting as an articulation disorder. So here we're going to start off with characteristics of students with language impairments. Language impairments meaning the impaired ability to understand and or use words in context. So we have expressive language disorder, which is difficulty in speaking ideas or needs. Receptive language disorder, which is the difficulty in understanding what others are saying. And then mixed language disorder, which involves both expressive and receptive language disorders. So this next video is going to be a student with an expressive language disorder.
So I was trying to think of a way of describing it. It's kind of like doing the tip of the tongue where you know the word but it just does not come to you. It's kind of like that. Very like all the time. I was a very quiet kid, so I remember I talked. So I tried to talk like my father. He also, I say, speaks funny, but maybe that's just because now I'm hindsight 2020 and play some. But I think there was I would say I don't know. I have. Sorry, I'm just trying to form my words. I think it was definitely there. It's just no one in around me really paid attention, if that makes sense. So, especially in a small town, there's not really a lot of resources for these just disorders, basically. There's no one.
So this is Grant, and I think he describes it the best. He's been living with a developmental language disorder, and he himself says that it's something that's literally on the tip of your tongue, that you know it, you just cannot say it. And this is something that I see because I have a smaller brother who has a language disorder, well, speech language disorder. And you could see that when we talk to him, he receives the information, but expressing it, you can see it in his eyes that it's there, it's right on the tip of his tongue, but he literally just cannot express it, and it's difficult.
So I was trying to
So both the expressive, receptive, and mixed language disorders all include improper use of words and their meanings, inability to express ideas, inappropriate grammatical patterns, reduced vocabulary, the inability to follow directions because it's just not understood, and they may also have trouble getting others to understand what they are trying to communicate. So, something that is a really big example on this is if a student who has language impairments, if their parents are English is their second language, those they when they learn English as a parent, they can sometimes cut words or not fully say the word correctly. And students who have language impairments believe that that's how they need to say the word. So then that kind of starts a little bit of a snowball on how they express their ideas. They may use the words and their meanings kind of improperly because they're learning from their parents who are English learners, and their vocabulary is a little bit reduced, and also other people may have trouble understanding what they're trying to say. So, some suggestions for the classroom on a virtual classroom setting is to help the child feel understood by asking them to repeat what they say, using different words, typing it in the chat box, drawing it on the whiteboard, or even using gestures. Using closed captioning if it's available, giving them wait time so that they can process information correctly and ask any questions during that time, rephrasing messages if the child doesn't seem to understand, and distraction is very common in students with speech and language disorders. So we need to minimize it by creating a physical setup. So this would mean working with the child's parents to make sure that their work area is very separate from all the people in the household, that it's quiet, and to get rid of any other technology or anything that could inhibit a distraction. So there needs to be interaction with peers, even on a virtual classroom setting. We need to make sure that these kiddos have social skills, and creating breakout rooms would help so that they have peer activity and even creating after school virtual activities. So for a traditional classroom setting, as a teacher, as an SLP, getting a copy of the student's IEP plan to better understand their disorder, to know what they're struggling with, and also see their goals, see what they've accomplished over the years, see what they have not met as a goal, and see what their future goals are so that you are better prepared to help them achieve their goals. Being patient when they speak in class, give them the chance to fully express their thoughts without feeling rushed so that they feel safe and want to participate and feel like they are heard. Talk about and celebrating differences is incredibly important for these students to feel included with their peers, and also it teaches the peers about inclusivity, especially at a young age. So, focusing on interests of all of the students that they all share as a whole. If the student gets distracted very easily, moving them closer to the front or to the teacher's desk, it helps them maintain focus and asks questions. Teachers also need to keep an eye out to make sure that they don't put these students in positions where they feel embarrassed, because that could definitely limit their participation in the classroom. So, here are some additional websites about speech and language impairments. This first website is extremely helpful for parents, especially if parents are first time parents. It can get a bit overwhelming to try and balance everything, to try and learn everything so that they're prepared for their first child. And so parents heavily rely on doctors and teachers to kind of tell them or to kind of keep up with the student and their milestones. So, what this website does is it gives so much information, specifically charts, so that it's easily readable, about milestones in certain ages. So, in months, in specific ages of what a student needs to be at, what their milestone, what they need to be developed already. So it's not just a chart for speech and language, but it also includes a hearing and vision chart of where their child needs to be. This second website is the Center for Disease Control and Prevention website, and it does a really great breakdown of speech and language disorders. So it includes tips on how to help children learn language, which is awesome, what to do if there are concerns, and how to detect problems. So this does give you like a step-by-step process of how to detect if it could be a speech language disorder and what steps you need to take, whether your child is already in school, whether they're not in school just yet and they are a bit young. There are some steps that you can take, such as early intervention programs. So that your student can be evaluated when they're in the school setting, of course, from preschool to 12th grade. That's when they would be evaluated. They would need your which, whether it's verbal or written consent, the school would need that to evaluate your child, go through all of these things that we talked in the previous slides to determine if they have a speech or language disorder, to determine if they need an IEP. Um, and it does briefly talk about the types of treatment that your child would be given so that parents know exactly what is going to be happening with their child in school. This last website is an amazing guide for parents to support speech and language at home. So as I said, there are some early intervention programs around the country that have child development liaisons, case managers. They teach and give resources to parents so that they can become their child's teacher. Now, of course, not all states, not all countries, not all counties have early intervention programs. So, this guide is awesome on providing parents with tips and tricks and activities to help their child at home. This starts off at a preschool age all the way to middle school. And it's a fun and interactive guide for both parents and kids, which is great to keep everyone's attention. It includes podcasts, book recommendations, even other websites that can really help parents be active in their child's educational development. And these are the references that we used. Thank you so much for watching.